Hi, my name is Bethany Smith. I'm a physician assistant at Fairfield Medical Center, and I work with the Bariatric program. Patients find that when they come to our office, we focus on getting rid of the stigmas of obesity. So we want to be patient-centered. We want to make sure that they feel this is a friendly, safe environment where at the end of the day, nobody's going to judge them for their weight. You're not just a number. You're a person, an individual. You have family, you have friends, people who care for you. We're really excited to work with you and have an opportunity to make that long-lasting relationship in your weight journey. For years and years, we basically thought of fat tissue as just being this inert tissue that is in our body, and basically it's just storage for energy. Now, as we've gotten more information out there from research, we've realized that fat tissue really isn't just inert. It actually affects us whole body systemically, in the sense that it creates all these hormones and it regulates our metabolism. Ultimately, when we talk about obesity, obesity is a chronic disease, meaning we need to think about a long-term plan that causes metabolic derangement, and therefore we need to do long-term solutions to work towards long-term health. Obesity is when that fat tissue is more than what it should. And so typically we diagnose this based on what we call a BMI. It's a height to weight proportion number. And it can be easily accessed online if you type in, calculate my BMI or BMI calculator, it'll pull something up. And basically that says, if for some reason, when I put in my weight to height, I come up with a BMI of greater than 30, I'm in the first category of obesity. And then we start looking at that chart, and when we hit 35, we're concerned about what we consider severe obesity. And then as we get up to a BMI of 40 and above, then we realize that functionally our body doesn't work the way it should with this fat tissue. There's guidelines set up by the NIH, and basically that says when we have a BMI, or that height to weight proportion, that's higher than 35 with at least one severe comorbidity or health concern related to my weight, then I qualify for surgery. Or let's say my BMI is 40, I technically don't even need those health conditions. Why? Because we know carrying this long-term weight is going to cause chronic damage to my organs and my systems, and therefore it needs treated. There are these surgical interventions that we know, and traditionally the big ones that we're talking about is a gastric sleeve or a gastric bypass. And what we're doing is we're rearranging the GI system in terms of creating different tools, not a easy way out for patients to effectively improve this metabolic derangement that obesity causes. There are kind of two main surgeries out there, and so this sleeve basically means that what I'm going to do is I'm going to create a small pen or banana-like shape out of the stomach and basically take out about 90% of the stomach, creating this small little thin channel, and ultimately that's going to help with my weight loss. When I talk about a gastric bypass, it basically says I'm going to create out of the stomach a little tiny pouch. I don't take anything out. I'm not going to actually remove stomach, but what I'm going to do is I'm going to take the small bowel and bring that up to the actual little pouch area. The stomach itself that's still remaining, the large portion of it, is now going to actually still function, creating gastric juices. It's going to pick up all the stuff from the liver, like bile, and also the enzymes from our pancreas. And then it's going to create this nice little Y shape. And that Y, the little tail of it, is the common channel. And so basically, I'm effectively allowing the patient to not only see restriction, but I'm also affecting a little bit about their absorption of how we're digesting that food. And that's what creates the magic as far as the weight loss. So the question becomes then, well, which one's better? And how do I choose which one is best for me? So when you meet with our team, typically we'll want to sit down and get to know you better. Look at your health conditions. We're going to look at what your current weight is. That makes a big difference. The bypass is actually known for having more weight loss, and so maybe that's a good reason for you to actually have that surgery instead. So we want to make this unique to the individual and then have a great conversation about, hey, this is what I think is best for you. Let's talk about it. How do you feel? Weight loss surgery is a tool. It's not the easy way out. It's not the quick fix. It's actually a long-term solution. We know that based on data. We know that based on the lives that we've affected and changed in our own program. We've seen it. We've lived it. We've been a part of those journeys. A lot of the times when I talk with a patient at their 1 year post-op, they'll say to me, I wish I would have done this sooner. I could have been spending the last 5, 10, 20 years a healthier, happier individual. And I really just didn't realize how much my weight affected me. And that being said, I want to be part of that journey. Our team wants to be part of that journey with you. And so if you're considering it, do your research. Come talk to us. Look it up online. Please use good sources. But that being said, I would keep an open mind and keep hope, because that's what we want to provide. Experience Fairfield Medical Center.